So we'd like to call our next speaker, Dr. Daminov. So the title of the talk will be Legal Issues of the Telerehabilitation Russian Experience.
Good morning, коллеги. Я расскажу о том, как развивается телемедицина в России. Есть очень большие два блока. Есть технологии и есть закон. И вот именно о законе мы сегодня поговорим. Моя коллега расскажет о том, что происходит в России, после чего мы ответим на все ваши вопросы.
Good afternoon, ladies and gentlemen. Now we are going to tell you about the Russian experience of implementation and development of telerehabilitation in Russia. So my colleague is going to give her presentation. After the presentation, we will be happy to answer all your questions.
Good morning. I have worked as a leading specialist in the field at a top Russian state hospital, Pirogov centers, for almost 10 years. It is my pleasure to share with you our experience in telemedicine and in particular in telerehabilitation. First attempts to use telecommunication for physician-to-physician interaction has begun many years before in the Soviet Union. This experience has become quite successful in such a big country where it was only the way sometimes to consult and educate doctors in remote areas with low population density, especially in the far north. Russian Federation consists of 85 regions. Each of them has a main regional hospital which provides the expert opinions and view for small rural clinics. These rural clinics can call the regional office to arrange a video conference to discuss difficult patients. Such connections allow specialists to study patients' files, including imaging, and exchange their opinions considering the management plan. In this way, telemedicine has worked quite successfully and effectively in our countries for years. On the other hand, telemedicine for patient-to-doctor communication has launched just a few years ago as a demand for outpatient rehabilitation, especially in remote areas. So why was such a need in telerehabilitation? First of all, there is a lack of institution and specialists providing outpatient service. Secondly, patients who need rehabilitation are often limited in their movements and simply cannot reach their facilities. And the last, and maybe the most important, is the lack of funding. Since January 2018, the Russian government made a new law considering telemedicine. Till now, we have gotten some experience to make first conclusions. It is important that the concept of telemedicine is unclear in our law. The law sees telemedicine as a way to provide usual medical services to patients remotely. This means that telemedicine is not considered as a new medical services. As defined by the law, medical service is a medical intervention aimed at prevention, diagnosis, and treatment of diseases, or its medical rehabilitation. Telemedicine is defined as information technologies that provide distant communication between medical works and between medical works and patients. The Russian interpretation of the concept is not different from the international. However, the purpose of the use of telemedicine technologies in the Russian Federation have certain differences. According to law, on the territory of Russia, it is possible to establish a diagnosis only if the patient comes to a personal meeting to the doctor. The reason for this decision seems reasonable to prevent poor quality medical services. From the other side, it moved telemedicine from medical services to general services. It has become some sort of counseling. What it is a law allowed by the law. The primary consulting via telemedicine, during which the patient complaints and history are called and analyzed. After this, the online counseling decides whether the patient should see the doctor to make diagnosis. Monitors the patient's status when a diagnosis was made personally. It is allowed to make some change in the treatment only if the treatment was prescribed after the personal first visit with a confirmed diagnosis. What are the difficulties and limitations of the telemedicine law? Only the attending physician who establishes the diagnosis during face-to-face can perform remote monitoring. All other doctors, even with a diagnosis in their hands, are in fact unable to conduct remote monitoring. This is a significant limitation for telemedicine. Only the attending physician can correct the previously prescribed treatment. All other doctors cannot interfere in the course of prescribed treatment. The doctor can communicate with the patient only from the clinic, requires special equipment and communication. If the doctor is not in clinic, when it is impossible to contact the patient remotely, for example, through a mobile application. The need to identify participants. United Russian Healthcare database uses secure accounts with protected personal information. Medical records are used mostly by doctors rather than the patient themselves. Patients are allowed to have the access to their files. However, the identification process is troublesome and most patients do not want to enter their profiles online. The fact is then, in some cases, it may be not obvious enough who exactly provides the patient with services and who will consult the patient later. Where is placed in the telemedicine services market in Russia? There are several types of them. Offline clinics, virtual clinics, there are services, there are lines to carry out medical activities, but at the same time, they do not have a traditional clinic in the offline. Usually, this is the departure of doctor to their house and subscribe remote monitoring. IT services for medical purposes. They do not have a license to perform medical activities and provide users with background information, for example, about possible symptoms of the diseases. IT services providing telemedicine. There are services for the doctor to communicate with a patient of a particular medical organization, of doctors of different medical organizations between themselves. What prevents the introduction of telemedicine in Russia? The main problems are legal protection and licensing of physicians engaged in teleconsultation, insurance and fees of telemedicine services, lack of educational standards and special training for doctors on telemedicine issues. Let's move to telerehabilitation. Skype or a Russian alternative messenger. Sessions with physiotherapists, psychologists, or speech therapists are conducted under the control of hemodynamics, blood pressure, heart rate. To do this, use a sensor. The main barrier in this case, the doctor is obliged to provide immediate response to any emergency. Some applications allow immediate feedback using Kinect. Such devices are expensive and don't have medical licenses. STEPS Rehabil needs no special devices and require minimal computer settings. STEPS Rehabil consists of 2 parts, a library of which more than 2,000 video files with exercise for training of imparted functions such as motor, cognitive, speech therapy. The second part is for the development of individualized program. At home, the patient or his relative opens a personal link with his program. Then he runs his personal training video with repetition, pauses, and tips between exercise. The patient sees the instruction and he only needs to mirror all the tasks presented. If the patient is severely disabled and needs some help of nurse and relative working at home, then they see on the screen how his avatar works with the assistant. The individualized training program have been tested at the Pirogov centers for 2 years. We can found it has been quite cost-effective. For example, the annual subscription costs 3,000 euro for a clinic and only 83 euro for patients. So it means the clinic can earn more than several 100,000 euro a year. What is special about this application? STEPS Rehabil does not require installation of a special software, the patient's computer, as it works through a browser. Preliminary studies have shown its effectiveness. While at various levels there are disputes about whether to register such software product, we have solved this problem somewhat differently. We promote it as non-medical but consultative. The fact is that the training program for a patient is developed by a specialist during. The application has a paid subscription for any period. It can be beneficial not only for patient, but also for clinic as a tested business project. Telemedicine and telerehabilitation is a promising direction. Nowadays we have many barriers to it, legal, financial, social. We hope to learn more from the experience of our colleagues at this great meeting, and we are very grateful for the inviting us to participate in your conference. Thank you for your attention.
Thank you very much for the presentation and guidelines. I think we have a lot of points to discuss, and people might have a lot of questions, but I will open the discussion now only for 2 short questions, and then we will continue.
Hello, I'm Sabrina from Malaysia. Have you had anybody suing the provider?
Could you repeat?
Suing, like any legal suits?
У нас suing. Have you already had?
Yes.
У нас были какие-нибудь судебные разбирательства. Connected to telerehabilitation? No.
So what if somebody starts to sue, like the first case, just hypothetically, a client at home, you guys are administering exercises and then has a heart attack, so dies probably. The family sues the provider, the Ministry of Health, and the whole organization. What is your action plan? Thanks.
Если в то время, когда клиент, пациент будет делать упражнения, он умрет от сердечного приступа, и члены его семьи пойдут в суд, там, на клинику, на Министерство здравоохранения, на все. То есть, что мы будем делать? Как?
Во-первых, это классические методики, и у нас нет биологической обратной связи в этой программе. Поэтому это только в рамках рекомендаций дается пациенту.
So all these exercises are not dangerous for health. But yes, you're right, according to our legislation, there is such a problem that if the client dies during the exercises, so it could be the doctor's fault. And that's why Russian doctors, in order to avoid it, they don't do it online. So clients do it themselves, because as Natalia said, that if something going wrong during online consultation on online doing exercises, the doctor should ensure emergency response, but he can't do it. That's why doctors try to avoid online treatment.
The reason why I asked
Thank you
is
very much. Let's proceed to the next question.
Yes, it's Anba Subramanian. I just wanted to ask you, you see that the doctor has to see the patient first and then is allowed to do remote monitoring. So does this not be the purpose of the telerehabilitation? Because the whole purpose is to try to look at how we can monitor the patient remotely to deal with the lack of doctors or other specialists. So, and especially nowadays, technology has moved on, and we're able to do so much remotely as well.
Sorry, what was the question? I'm sorry. I'm not a native speaker, I'm not a doctor, and I'm confused a little bit.
No, I just...
It was your statement, it wasn't a question.
No, it was a question.
Which one? Sorry, I'm really sorry.
No, my question is, what are you going to do about this? Because the impression I get is that for the time being, the law does not allow doctors to get involved. Okay.
Согласно закону, мы не имеем права ставить диагноз дистанционно, да, то есть наши дальнейшие шаги в этой области.
Я думаю, что в ближайшие годы в России диагноз ставить дистанционно будет нельзя. Именно это является основным барьером развития телемедицины и телереабилитации.
Professor Daminov thinks that for the next years it won't be able to establish diagnosis online, and it's one of the main obstacles to the development of telemedicine in Russia.
Все консультации по телемедицине, все первичные консультации заканчиваются либо рекомендацией обратиться к врачу, либо к врачу не обращаться. Но по нашему опыту всегда принимается решение о том, что нужна очная консультация у врача.
So the aim of most of remote consultations is just to say if the patient needs an online and face-to-face visit to a doctor or not. But in most cases we recommend to go to the doctor's office in person.
В России сейчас формируется большая платформа, в которой будут храниться все данные 140 миллионов жителей России. К этой платформе, медицинские данные, к этой платформе будут иметь доступ врачи государственных клиник. Но пока этого не произошло. Пока вокруг каждой крупной клиники есть свой пул пациентов, привязанных к этой клинике.
So nowadays in Russia a big platform is setting up which is going to be a database of all citizens of Russia. So and all doctors from different regions, from different clinics will have an access to it. But at the moment each particular clinic has its own database.
Thank you very much. I hope that all of you got the answers, and if not, please refrain the questions for the last discussion after the session. Thank you very much.
Thanks.